this is Shahul. Today I am going to speak about osteomyelitis. Osteomyelitis. Osteo means bone, myel means bone marrow, itis is inflammation. Osteomyelitis is nothing but inflammation of the bone and bone marrow. We broadly classify osteomyelitis into acute osteomyelitis and chronic osteomyelitis. Acute is one which occurs acutely, the manifestations are acute, and when that acute osteomyelitis goes for chronicity, then we call it as chronic osteomyelitis. Okay, done. The most common people to get affected are children and people who met with an accident. So we have to know the reason why it is more common in children. To know that, we have to know a bit of anatomy about the bone. So bone is made up of epiphysis, metaphysis and diaphysis. So epiphysis is there, metaphysis is here and diaphysis is below it. And for growing children we have epiphyseal cartilage, which is growth cartilage, which grows below forming metaphysis. And that epiphyseal growth plate requires a huge amount of blood supply. And the blood supply goes via the medullary vessels. They ascend up in the region of metaphysis and the epiphyseal growth plate. They divide into a bed of capillaries, and the capillaries once again reunite to form venules and veins, and they come down. So they form a hairpin-like structure. Arteries go there, form a capillary bed at metaphysis, and they come down as veins. So that capillary bed forms a suitable medium for settlement of the bacteria. Bacteria get lodged in those capillary beds. Okay, so this is why osteomyelitis is common in children. And the most common mode of spread of osteomyelitis in children is hematogenous. And for adults, it is accident. Like we know that bone is is present in a zone which is very completely aseptic. For a bacteria to come from external environment to bone, it has to pierce skin, superficial tissues, muscles, and then it has to reach the bone. So it is not that common, But when there is an open fracture, when the bone is communicating directly with the environment, then there are more chances that the infections may get directly into the bone and bone marrow, causing osteomyelitis. Okay, done. So what is the pathology? What actually occurs in osteomyelitis? To know that, we have to know a bit about inflammatory process. What is infection? The definition of infection is multiplication of bacteria. Whenever there is a suitable environment for the bacteria to grow, the bacteria multiplies, right? So when the bacteria gets lodged at the metaphyseal region, at the capillary beds, the bacteria starts multiplying. I am explaining the hematogenous spread. So bacteria starts multiplying in the capillary bed, and the the protective mechanism for infection is inflammation. Our body pours all the inflammatory mediators into that region. So automatically there occurs a fight between the bacteria and the inflammatory mediators. And the inflammatory mediators release enormous amount of proteolytic substances and destroying substances that they destroy the region of bone. So automatically this cellular debris, inflammatory mediators and bacteria form a fluid called as pus. So there is collection of pus in the bone and bone marrow when the bacteria multiplies, especially at the metaphysis. Okay, done. So, and one of the reaction of a bone to an injury is deposition of bone in the periosteum. So subperiosteal bone deposition is one of the finding of acute osteomyelitis. So bacteria gets lodged, bacteria starts multiplying, inflammatory process occurs, inflammation happens, pus forms, subperiosteal reaction is there. This is what the presentation of this is how osteomyelitis occurs in a bone. But when it goes for chronicity, the pus may spread and the pus may get collected, the periosteum forming, discharging sinuses and all those things, and all those are chronic osteomyelitis. In acute osteomyelitis, only there is formation of pus. Okay, done. So how does a child present with osteomyelitis? Because osteomyelitis is a very common condition. Many children will be coming to your OP department with a pain. The presentation will just be pain, severe tenderness over the region of ends of bone, because metaphysis is at the ends of the bone, and the most common site is knee. Lower part of femur or upper part of tibia. So in and around knee, not in the per se knee, in and around the knee is the common site for acute osteomyelitis. So the patient may present with pain. The child will present to you with severe pain, tenderness. When you touch, the child won't allow you to touch, and constitutional symptoms will be there, like fever or chills or rigors, myalgia, all those constitutional symptoms will also be there. Occasionally, the child may also have a joint effusion of the nearby joint. For example, if there is osteomyelitis of lower end of femur or upper end of tibia, there will be effusion of the knee joint. That we call it a sympathetic effusion of the knee joint. So sympathetic effusion of the knee joint can also be one of the clinical feature of osteomyelitis. Okay, you have diagnosed it clinically. Let me tell you one point. A child presenting with pain, tenderness at any ends of the bone with constitutional symptoms is the diagnosis for acute osteomyelitis unless otherwise proved. Most common presentation is this. If the child comes with all these features, you brand them as having acute osteomyelitis and you start your treatment. But before starting treatment, you also opt for investigations, right? So investigations include X-ray. In X-ray, you can't find anything here. In acute osteomyelitis, there won't be finding at all. We will diagnose it clinically, but sometimes periosteal reactions can be there in an X-ray finding. There will be increased bone deposition at the periosteum. Will be one of the feature of acute osteomyelitis. Okay, you have diagnosed it as osteomyelitis, but one thing what you have to notice, you also have to have a differential diagnosis for that. You can the same presentation can also be there in case of pyogenic arthritis or rheumatoid arthritis. So you have to rule out all these conditions. Okay, then how do you start your treatment? So the treatment is based on a broad category. Before 48 hours of onset of symptoms or after 48 hours of onset of symptoms. Then the point where 48 hours we put as before 48 hours, there won't be collection of pus. But if the time is beyond 48 hours of after the onset of symptoms, we assume that the pus might have formed. So if it is before 48 hours, we start with IV antibiotics. We start with broad spectrum antibiotics, and after culture and sensitivity, we start. If culture and sensitivity is done, then we can rely on culture sensitive antibiotics. So IV and especially IV antibiotics has to be given for 2 weeks. After that, we can convert to oral antibiotics for 6 weeks. We can give vancomycin or cloxacillin, and many antibiotics are there for treatment of acute osteomyelitis. Okay, now at last we are going for complications. What are all the complications that can occur in case of an acute osteomyelitis? The most common complication is chronic osteomyelitis. If the child is not being determined, if the child is not diagnosed early, or if the antibiotic treatment is not proper, or if the virulence of the organism is small, the child can go for a chronic state. So chronic osteomyelitis is one of the commonest complications of acute osteomyelitis. Sometimes the pus may spread to the joint, producing pyogenic arthritis, or the bone may get weaker, forming pathological fractures, producing pathological fractures. Thanks for watching this video. Stay tuned for the next video, that is chronic osteomyelitis. Bye.